folks to this channel of Department of Psychology, Dr. MJ Education Research Institute, deemed to be University. I am Manoj, clinical psychologist. This video is a continuation of the previous video on the 4 critical professional skills essential for psychologists. And in this video, we are going to talk about the second important skill, which is very essential for any psychologist, which is exclusive to psychologists alone, and that is psychological assessment. Today, many people claim to be conducting psychological assessment using some checklists or questionnaires which they download from the internet or which they got access to. And they just administer it in a very casual manner, sometimes with individuals or sometimes to groups. And then based on the responses from the patient, without observing what is actually happening during the testing process, they come to conclusions only based on the responses which is received from the patient in the checklist or the questionnaire, which does not give the real picture of the condition of the patient. Psychological assessment requires dedicated time, dedicated observation, and complete focus when it is being administered to the patient, and it should be administered in a condition where the patient feel comfortable and also in a way which can be understood by the patient so that we get the best results from it. Psychometric assessment can be done only after completing a proper case history taking, mental status examination, and it can we can use it either before the case formulation or sometimes after the case formulation, depending on the situation and depending on the need of the client. But the case history taking an MSc is very essential to decide on what type of psychometric test can be used, what type of psychometric assessment needs to be done for the client, because if we are not able to get the proper information, if you are not able to understand the status of the client properly during the case history taking an MSc, we may not be able to use the right test the right way and conduct in a manner where we will be able to get the best results from the test. What is the psychological assessment? Psychological assessment is the process of evaluating an individual's mental health, behavior, and cognitive functioning in the current status and also the current status of emotionality through the use of standardized test, observation, and few other methods, which is just a part of the test conducting process itself. A psychological evaluation or assessment may consist of a series of formal or structured psychological or neuropsychological tests. It also includes some clinical interviews designed to identify and describe the emotional, behavior, and learning problems in the patient. There are questionnaires and checklists to assess the symptoms and intensity of the symptoms and to identify the personality type or the current emotional status of the person. But the most important tests are the projective test, which is exclusive to the field of psychology and psychologists, which is used to unveil the information consciously hidden or suppressed by the patient, or information which is suppressed into the unconscious part of the mind of the patient, which the patient themselves may find difficulty in identifying. But all these factors has an impact on the mental health, the behavior, and cognitive functions of the patient. Ways to developing skill in psychological assessment is acquiring knowledge in various type of tests that are available to assess various factors affecting the client. Along with that, training in using appropriate psychological test and also effectively administering it. By understanding the nature of the client, the capacity of the client, or what is the mental status of the client, can only help in ascertaining the information which is already available, which we have collected through various sources such as case history taking or mental status examination, or the information which we have received from some of the primary caretakers of the client. So all this information can be validated by using the appropriate psychological test and effectively administering it. Along with that, the areas that has not been explored during the case history taking or mental psychological status examination, and also which the patient has not revealed, either consciously or unconsciously, can also be understood by administering the psychological assessment or psychological test in a proper, effective manner. The general approach of any patient who comes to a psychological setting is to maintain his socially desirable image, to see to it that there is no big dent in his image because of the nature of thought process or the nature of problem he is undergoing. And many times this is because either they are worried about the fact that they may be labeled as a mentally ill person, or they feel that their problem is not really serious, but all they need is just some simple support, or sometimes when they are forced to come to a psychological setting just for the because of the pressure from people around them. Expertise in projective tests is a most essential skill to understand these patients, and because this projective test helps in exploring the unconscious needs, drives, and motives, and the structure of personality of the person. It also helps in unwrapping some of the information which is withheld by the client to maintain its socially desirable image. Projective tests can be only administered by a trained psychologist who has developed the expertise in conducting the projective test and also in analyzing the responses which is received from the complaint or from the client on the projective test. The other set of psychometric assessment which a psychologist needs to be trained in is the test to assess the cognitive abilities and neuropsychological functions such as attention, concentration, memory, intelligence, specific aptitudes, learning disabilities, etc. This is very essential because it is not just for these tests are the ones which are not just used in people with any specific mental conditions or mental issues or mental health problems, but also in normal population to assess their capacity to function and also what is the extent to which they can really perform. The real professional expertise is not just the knowledge in the tests that are available to assess various factors associated with the client, or the experience and expertise in administering these tests, or the expertise in analyzing the responses of the test, but also in identifying the right test to be administered for the right. Once the right test is identified for the right client, then it should be administered in a customized manner with the unbiased objective observation of the client. Because only if the client is able to understand the questionnaires or understand the instruction associated with the activities of the test properly, then they will be able to produce the best of the results. Unbiased objective observation of the client throughout the process of the test being administered is also very essential, because that can only help in understand the areas, specific areas which the client may be facing difficulty in responding to the test, or the areas which the client is deliberately resisting a response to the test. Administering the test in a very customized manner to the client and unbiased objective observation of the client can only produce the best results from the test, which can help in evaluating the client properly and proceeding with what we can do best for the client.